Okay, here we go. We're gonna go through most of our EMT, trauma, and medical assessment. And it's gonna be pretty brief due to the time limit, but start with PPE, personal protective equipment. Once we put that on, we can get on scene. You first check, is the scene safe? How many patients are there? And essentially what's going on, right? What's their MOI? And if the MOI is serious, maybe they need C-spine. If there's multiple patients, or the MOI or NOI is really serious, maybe they need ALS, maybe they need a medic, and maybe like an intervention en route. So that's the thing. Made this a little mnemonic. I don't think it's the most helpful because it's not in order, but it's there. Next, we go to the primary assessment. You form a general impression. You check the responsiveness. You check for alert to verbal stimulus, pain, or just in general, or if they're unresponsive, check their chief complaint if they're talking, look through any life threats like exsanguination if they're bleeding a bunch. If they're not, you go through the airway, you assess it. Is it open? Is it patent? Do they need an adjunct? Can they maintain their airway? You go through breathing. Are they breathing? Are they getting ventilations? And is the perfusion actually happening to tissue? Next, are there any compromising injuries that could cause the breathing to be compromised later? I use compromise twice to define compromise, so sorry about that. But next, we got O2 therapy. How much oxygen do they need, if any at all? Circulation, what's their pulse? How's their skin? And how's their temperature? That scribble says major bleeding. And then finally, if they need to, they're hypotensive, treat for shock, lay them supine, give them a blanket. Next, you make a transport decision based on their GCS, and we move on to history. This might be done in the back of ambulance, or if they're not as serious, might be done on scene. So the vitals you need are blood pressure, pulse, and respiratory rate, but you got a lot of extras. OPQRST, onset, provocation, quality, radiation, severity, time, and sample, signs and symptoms, allergies, medication, past medical history, last oral intake, and events leading up to the call. And finally, we go through ANO times 4. So are they aware of who they are, their significant others, person, place, where they are, time, what's the day, season, and why did 911 get called? So what's their situation? Next, in case of trauma, we have this trauma assessment. So IP means inspect/palpate the scalp, ears, eyes, mouth, nose, and facial area. Neck, you can kind of just read that. We're just gonna kind of skim through a lot of this, but tracheal deviation, jugular vein distension, C-spine, chest, auscultate, palpate, abdominal area, pelvis, check for priapism in case of serious trauma, palpate, get PMS, pulse, motor, and sensation, and posterior thoracic, lumbar,